Good evening, Peter Goertz. I'm a psychiatrist. Let's talk about Depakote or valproic acid, and the roots of things can be fascinating. So valproic acid was used as an organic solvent in research laboratories for many decades, apparently, until the fortuitous observation of an action against pentylene tetrazole-induced convulsions in rodents was discovered. Amazing. And that was discovered by Pierre Aymard in France in 1962. Valproic acid is liquid and was used as a lipophilic vehicle to dissolve water-insoluble compounds during preclinical drug testing. And the researchers found that the vehicle, not what they thought was the active substance, but the vehicle that they used to dissolve things, valproate, alone exerted an anticonvulsant effect against pentylene tetrazole-induced convulsions. So that's how valproic acid came to be used in medicine, and it's used as an antiepileptic, as an anti-migraine drug, as an anti-manic drug, and also we use it in psychiatry sometimes as needed for agitation in its oral form or in its IV form even for the agitation. Like any drug, it's a double-edged sword and it can cause many side effects. So off the top of my head, going from top to bottom kind of, it can cause alopecia, so hair loss, which for ladies especially is a problem, pancreatitis, increased liver function tests, and elevated serum ammonia level. Also, it can cause thrombocytopenia, platelet dysfunction. So if someone develops a, quote, rash while they're taking valproic acid or Depakote, it may actually be petechiae, so little spots of bleeding from thrombocytopenia or platelet dysfunction. So we want to be careful with that. Valproic acid can cause polycystic ovaries. So in general, it's not a good medicine for women of childbearing age, but it's always a balance and between side effects and good effects. It can cause in the fetus neural tube defects. It can cause a tremor in people. So many different side effects, and there are more. It can cause ataxia, let's say if it gets toxic, if the level in the blood of valproic acid level is too high. And in general, we shoot for a level in psychiatry of between 50 and 100. If someone is on the edge, very agitated, we want to shoot for a level probably around 100. I've even seen people do reasonably well with a level of valproic acid in the blood. That's a trough level. So I've seen people do reasonably well with a level of valproic acid level of around 120 even, but you want to be careful. And we want to follow, because of thrombocytopenia and platelet dysfunction, we want to follow a CBC if someone's on valproic acid or Depakote. We want to follow the liver function tests. We want to follow the serum ammonia level. And the valproic acid itself has a half-life of about 8 hours. The Depakote, which is divalproic sodium, and that is valproic acid and sodium valproate in combination. So the Depakote has a half-life of about 12 hours. And then there's Depakote ER, so extended release Depakote, which is generally given once daily, for instance at bedtime. So the Depakote ER has the longest half-life. And you want to be careful with drug interactions with valproic acid, specifically and especially the valproic acid can increase the blood level of lamictal, so lamotrigine. So we want to be very careful if you give valproic acid with lamictal or lamotrigine. And I've seen it be very effective. I used to work on an inpatient hospital ward where there were many patients who were on the edge, quite agitated often, and we really needed to achieve behavioral control, which sounds coercive, but safety is really a priority in general, but also on locked inpatient wards, safety of the patients and the staff. So for the chronically psychotic patients who could be dangerous, we had many of them on a combination of clozapine and Depakote. Thank you very much.